It all starts when mom and her baby take the time to get ready first. That means getting comfortable with pillows for extra support if they need it. It also means making sure the baby is ready too. If the baby is fussy or crying, try calming him first by holding him skin to skin or rocking or swaying the baby. The champion can help with this. One of the best ways to latch the baby in the hospital is to use a laid-back breastfeeding position. This means lowering the mother's bed rail so she's semi-reclined. The baby is then placed on top of the mother's body so that his body is fully touching his mother's body. This helps the baby work with gravity rather than fighting against it. This full body touch also triggers special sucking and feeding instincts so the baby can latch better. For mom, this laid-back position is much more comfortable. She doesn't have to lean over the baby or put stress on her back, her neck, or her arms. Both she and her baby can now relax and enjoy the feeding. To be sure the baby is latched well, here are just a few things to look for. First of all, hold the baby so he's close to mom. Baby shouldn't have to turn his head to reach mom's breast, just like we as adults do not turn our heads to eat. The baby's head, shoulders, back, and hips will be in a straight line. Mom can support the baby's shoulders so his head tilts back a little and his nose is pointing toward mom's nipple. This will help baby open his bottom jaw so he can take in a large amount of the mother's nipple and the dark part behind it. Wait until the baby opens his mouth wide like a yawn, then bring the baby in close to latch. Check for a good latch. If the baby is latched well, it won't hurt or pinch, and mom will be able to hear or see the baby swallow. Mom can check to be sure the baby's nose is touching but not indenting the breast. She should see more of the dark part behind the nipple above the baby's mouth than below it. Her champion can check to be sure that the baby's lips are flared out like fish lips. If it doesn't feel right, the parent should call the nurse for help. There are lots of other ways to hold the baby, but in the hospital, it's best to start with this laid-back breastfeeding approach. Moms who have had a C-section can place their baby above their incision or can be taught the clutch hold, feeding the baby from their side. This will help take the pressure away from their incision. Other holds, such as the cross-cradle hold, side-lying, and cradle hold, can be taught before mom leaves the hospital to try out at home.